Hi everyone. I decided to have this recorded session, no, because I want to make sure that I have guided you enough in doing your family health nursing process. So I know that we already have prepared modules. Ma'am Filoteo also and Ma'am Sugay had already sufficiently prepared for your recorded lectures. Pero just the same, me as your assigned professor, I also want to ensure that I have given my inputs also on guiding you so you can successfully complete your family health nursing process. I believe that we have repeatedly discussed already on how to do your assessment database or your initial database, the 5 categories of data that you need to complete as you gather these the specific details of this data so you can describe appropriately the family as a client. So yun nga yung limang categories na yun, di ba? Yung family structure, characteristics, and dynamics, sociocultural and socioeconomic and cultural characteristics, home and environment, the health status of the members of the family, and also the values and practices for health maintenance, self-management, and also disease prevention. So yung limang yun, alam ko gamay na gamay nyo na yun. And also, alam din natin I also believe that you already know the output or the outcome from the first level of assessment, also the second level assessment, yung ating mga nursing problems, di ba? Yung four main health problems or nursing problems, ba? Yung foreseeable crisis, health threat, health deficit, tsaka yung wellness conditions. And under those, sa main problems na yon, using the typology of nursing problems by Dr. Araceli Naglaya, marami kayong pwedeng ma-identify na specific problems based on the data that you have gathered, diba? Based on the data per category. So I believe that you are very much capable of doing that already. Even yung scoring, I also believe that you know how to do that. So I want to focus my discussion for this session on ensuring that you have done the rest of the steps. Diba? Kasi sa prioritization, tsaka syempre, yung lecture din sa inyo ni Dr. Sugay on planning. Pero katulad nga ng sinabi ko, I also want to give my inputs. So let's start with the formulation of goals and objectives. Kasi meron akong mga nare-receive na questions about the goals and objectives. Actually, even nga sa health teaching plan, when you formulate your goals and your teaching objectives, learning objectives, marami pa rin ang nagtatanong. So kaya I decided now, sige, let's see. I also want to share my input, and I hope, that my discussion will be able to help everyone, develop the skills. Okay, so yun nga. So a goal is a general statement, diba? It's usually a broad statement, of what? Of the condition or the state, that you want to achieve, or the state or the condition to be brought about by the specific courses of actions that you're going to take, so that you can resolve a particular nursing problem. So, an example of that statement in family health nursing practice, as given by Dr. Maglaya, is after nursing intervention, the family will be able to take care of the disabled child competently. So, ang broad, di ba? The family will be able to take care of the disabled child competently. No? Na makikita yun doon, kumbaga, that particular that particular goal parang aligned doon saan pang ilang health task, di ba? Doon sa pang-apat na health task, the ability to provide adequate care to the sick member of the family. So, parang yun ang kanyang nursing problem na ina-address ng goal na to. Okay, so a cardinal principle in goal setting states that the goals must be set jointly with the family. Take note, no, during the implementation, no, or during the actual exposure, especially kayo, wala kayo ngayong actual exposure with the community. But of course, during your third year, you will have again community health nursing. So doon natin may apply, doon nyo may apply. And hopefully by the time, meron na tayong face-to-face interaction, which actually we are very hopeful, di ba? Kasi meron na ulit na meron nang yung na-develop na vaccine. Sabi nga according to the study conducted ng Pfizer ng kanilang dine-develop na vaccine, 95% na daw ang efficacy. So we are hopeful that next year mapunta na tayo sa ating partner community na Wawa. So again, going back to the topic, formulation of goals and objectives, kailangan maalala natin na when we formulate goals and objectives, we do it jointly with the family. We don't formulate goals and objectives on our own as much as possible. Why? Para may participation ng family, para may sense of ownership, para may sense of accountability, para may sense of involvement. Diba? Kasi kung tayo ang mag-identify ng goals and objectives on our own, parang hindi sila, walang sense of involvement ang family. Parang ang dating, tayo ang nandun para bigyan ng solusyon ang mga problema nila. But when we formulate goals and objectives with the family, jointly with the family, then they will be actively involved, no, in the process of resolving that nursing problem. They will become aware na ang goal na yan kumbaga siniset natin na goal, no, para ma-improve kumbaga ang level of health ng family, and specifically for the family to be able to perform, no, their family health tasks. So importante naiintindihan ng pamilya kung ano ang kanilang family health task, di ba? Yung 5, kaya kayo dapat alam na alam ninyo yung 5 family health tasks na yon, di ba? Yung the ability to recognize the presence of the problem, ability to make decisions with respect to taking appropriate health actions, ability to provide a home and environment conducive to health, ability to provide adequate care to the sick member of the family, and then ability to utilize community resources. So, dapat ang goal natin will be directed towards the fulfillment, no, of that role, of that family health task with respect to a particular nursing problem. Okay? So, yon. So, their involvement, when we formulate goals and objectives jointly with the family, it will ensure the family's commitment. In short, no, commitment saan? To the actions, to the realization of the goals. Kasi kasama sila na nag-set ng goal na yon. So it will be also their commitment na ma-achieve yon, ma-realize yung goal na yon. No? So basic to the establishment of mutually acceptable goals is the family's recognition, no, and acceptance of existing health needs and problems. Okay? Kasi baka naman yung existing health needs na yon, mahirap kapag hindi nila nare-recognize na health need nila yon. O mas lalong mahirap kung hindi nila nare-recognize na health problem pala yon or problema pala nila yon. So the nurse must ascertain, no, the family's knowledge and acceptance of the problem. Tandaan natin yan. No, as well as the desire to take actions to resolve them. Okay? And take note, those two, we can achieve already during the assessment phase. Diba? Habang nag-gather tayo ng data, if you experience, no, diba, nag-gather kayo ng data with your family. So, I'm sure na-experience niyo na habang tinatanong ninyo yung parents niyo or yung kapatid niyo, in the process, parang may mga interventions na kayong ginagawa because it helps them become aware, no, of some problems. So the assessment phase is already where the two family health tasks are being addressed actually. No? So again, those two, the ability to recognize the presence of the problem at ang the ability to take appropriate health actions. Okay? Now, there are times na merong barriers yung goal setting between the family and the nurse. So ano-ano yung mga barriers na yon? Importanteng naiintindihan natin at nare-recognize rin natin yung mga barriers na yon para we will know how to deal with them, di ba? As we go along with the process. So, Dr. Maglaya discussed these barriers as number one, failure on the part of the family to perceive the existence of the problem. And in many situations, in many instances, the problem is seen only by the nurse. No, while the family is perfectly satisfied no, with the existing situation. So masaya na sila dun eh. Parang hindi na nila nakikita ang need pa to improve. Yon. So another example is that is the threat no posed by improper waste disposal. So many families, especially in the rural areas, no, have no sanitary toilet facilities. Buti na nga lang recently may programa ang gobyerno eh. Yung zero, ano ba yung program na yun ng gobyerno na dapat lahat ng bahay merong toilet. No? Lahat merong palikuran. So sinusuyod yan ng mga local government units, ang kanilang mga barangay. And they come up with that kind of program na they will ensure na bawat bahay ay merong sariling toilet. Kasi pag pupunta ka sa far-flung areas, makikita mo doon yung mga bahay na wala silang sariling palikuran. Nakikigamit sila sa kapitbahay or siguro sa relative at yung iba naman itapon na lang, ballot system. No, so for these families, this is not a problem at all, no? Yung wala silang sanitary toilet facilities. And bakit? Bakit hindi problema? Eh, dahilan nila, malawak ang kabukiran. Malawak ang bukid. Di ba? Para gawing, palikuran. So, o kaya, yung mga, sa gubat. Di ba? O kaya, ipaanod na lang sa ilog. No? So, which can also serve the same purpose. So, yun. And when the family ay ganito ang mentality, so, paano mo ngayon the challenge is for you to make them to make the family see the importance of having their own sanitary toilet facilities. So I'm sure right now you're already thinking of possible interventions. How are you going to convince the families to appreciate the advantages or the benefits of having your own sanitary toilet facilities? Okay, and we will not yet discuss that. So I'll leave you to imagine those interventions. Now, next, another barrier is the family may realize the existence of a health condition or a problem, but they are too busy. They are too busy with the other concerns in the family. And maybe they are preoccupied with work, with study, preoccupied with other problems, preoccupied with other concerns. So one example of this is yung isang nanay, she may perceive the need for immunization of her children as less important than the household chores. No, so marami pa siyang kailangan gawin. Pagod na pagod siya, maglalaba, maglilinis, magluluto, magpapaligo sa mga anak, lalo na kung maraming anak. So unahin pa ba naman niya ang pagpupunta pa ng health center? Eh ang tingin niya sa pagpunta sa health center, nakikipagchismisan lang dun yung mga nanay. So minsan may ganong mother, na ang isipin niya, dito na lang ako sa bahay, ba't pa ako pupunta dun sa health center? Eh nagsisismisan lang naman sila dun. So, hindi niya nakikita yung kahalagahan ng pagpunta doon at pagpapa-immunize sa kanyang mga anak. Especially recently, di ba, nung nagkaroon ng scandal sa Dengbaksya. So, naging problema yun, di ba, ng Department of Health. Naging problema natin yun dahil yung iba, nawalan sila ng tiwala sa bakuna. Kaya nga, di ba, yung polio cases natin bumalik. Kaya, ang tagal na nating polio-free na country. But then recently, because of that scandal, because people lost the trust on immunization and its efficacy to prevent the development of childhood illnesses, diseases. Kaya ayan. So yon. So that's second. And number three, the third barrier could be sometimes the family perceives the existence of a problem, but does not see it as serious enough not to warrant attention. Okay, so na water down, kumbaga. So the common cold, for example, uh, is often taken for granted. Diba? Ngayon lang naman nagkaroon ng special attention ng common colds eh. Ngayong may COVID, 'di ba? Yung cough, yung yung lagnat, lagnat laki lang 'yan. Pero ngayon, lagnatin ka, ubuhin ka, maka-quarantine ka na. So, um, another example is yung bulate. Sasabihin minsan ng mga nanay, natural, bata kasi talagang may natural na magkabulate yung bata. No? So, parang sabi nila, yeah, it's a normal, kasama sa paglaki. Normal part of growing up ang bulate. As a healthcare worker, do we agree with that? Well, you will have discussions on communicable disease, no, and you already have you also have discussions niyan sa pediatric nursing. Yan. Kaya well, you as a beginning nurse, no, a student nurse, you know very well ano ang mga possible problems, no, implications, health implications of the intestinal parasitism. Okay, so next barrier is the family may perceive the presence of the problem and the need to take action. However, they refuse to face and do something about the situation. Bakit kaya? Bakit nape-perceive naman nila na may problema? At alam naman, nare-recognize din nila na kailangan, there is really a need to take action to resolve that problem. Kaso, pwedeng takot sila. Saan? Sa consequence. Ng alin? Of taking action. For example, diagnosis, pa-check up. Takot silang malaman na meron palang ganitong sakit. Bakit? Kasi at the back of their minds, they're worried about the expenses. Or it could be they are afraid, of the social stigma. Like maybe, for example, AIDS. No, di ba? So recently, nagkaroon ng shoot up ng AIDS cases. Di ba? Lalo na yung mga, those who are involved in unsafe sexual practices. Di ba? So, those who are engaging in promiscuous behavior outside wedlock. Kasi with wedding, you as much as possible, you are ensured na isa lang ang partner mo. Pero kapag ikaw ay single, we really do not know. So those who are engaging in sexual promiscuity, so syempre they have high risk in developing AIDS. Lalo na kung very active. No? So sometimes nag-eyeball lang, wala na. Diba? So, yun. Ngayon, biglang nag-develop ng kung ano ng mga symptoms, tapos naging paranoid na baka may AIDS o baka may HIV, baka ganito, biglang. So, or kaya baka may Hep B, mga ganon. So, ayan, takot, kaya ayaw gumalaw. Takot, kaya ayaw gumawa ng aksyon. Kahit alam nilang kailangan. Or another reason could be the tradition. Some people wanted to respect the tradition. Like for example, in our culture, ang mga matatanda usually are actively involved in decision making. Diba? So sometimes kapag yung may mga may mga desisyon na hindi ayon yung matatanda, so syempre wala silang gagawin kasi ayaw Ayaw ni lolo, ayaw ni lola, bawal. Another example is yung a couple, no, na they may not accept the goal of limiting the family size to just maybe 3 children. Kasi hindi naman accepted ng family nila yung contraceptive practice. Naniniwala sila na, yun nga, hindi naman design ni God na ilimit yung pag-aanak. So, ganun yung pananaw nila. So, hindi maybe nila naiintindihan na hindi mo naman pipigilan o hindi ka naman mag-a-abort, kundi proper spacing ka lang ng pagbubuntis para masigurado na masusuportahan mo yung mga anak mo. Because part also of the divine calling, no, God's calling to those people, no, to those people who get married, ikasama doon syempre yung responsableng pagpapalaki sa mga anak. No, responsible parenthood is part of being is part of the calling of being is part of the calling for marriage. Hindi naman pwedeng tinawag kang kumbaga sinabi ni God na o sige, mag-asawa ka, magpakarami. Pero nandun din naman yung mahalin mo yung mga anak mo. O, kung mahal mo yung mga anak mo, you will provide for them, for their needs. So kung alam mo na hindi kaya ng bulsa mo na magpagpakain ng 5 anak, 8 anak, di ikaw mismo ang magkokontrol. Ba? Hindi naman sinabi ng contraceptives na hindi naman sinabi na although syempre may iba talagang contraceptive practices na maybe bawal talaga sa kanila. So maybe we can give them those natural methods of family planning. Okay? So yun, respect for tradition. And then next is the failure to perceive the benefits of action proposed. So this could be a function of a client's previous experience with healthcare workers and their services. Like going to the health center, for example, where an advice is frequently given by the nurse. So kapag hindi na-resolve ang problema nung sinunod niya yung advice ng nurse, di mawawalan siya ngayon ng tiwala. So, next time na mag-o-offer ulit ng another suggestion ang isang healthcare worker, hindi na naniniwala. So, yun. Kaya importanteng naiintindihan. No, naiintindihan ng pamilya. No, na kumbaga, ang desisyon ay nasa kanila. Dapat may sense of ownership ng decisions. No, na ipaliwanag sa kanila yung possible yung possible effects, implications of their decisions. No, na sometimes may mga health decisions na hindi naman yun ang kumbaga sure ball decisions, interventions. Kailangan merong allowances. No, na na ino-observe. Okay? And in the end, it's the family who will decide. Okay? So, yan. And then next barrier, next reason, that the family will not be able to take the appropriate health actions could be the failure to relate the proposed action to the family's goals. Kumbaga, hindi akma dahil iba ang priority ng pamilya. Diba? So kapag iba ang priority ng pamilya, iba ang goal ng pamilya, mahihirapan ka, or mahihirapan silang i-prioritize, yung or piliin or gawin yung decision or make appropriate health actions. Okay? Like for example, the economic and the social goals. Usually, the economic goals and the social goals they occupy a higher position than health goals in the family. No? So pag tinanong mo ang pamilya, sa tingin niyo po ba, alin dito yung gusto ninyong problema na maunang na kailangan na talagang ma-resolve? No? Or gusto ninyong resolbahin na? So yun. Baka isabugot sa'yo, ito, malayo dun sa, di ba? Dun sa gusto nating health goals. Kasi uunahin nila yung economic and social goals. So, when proposed actions to improve health are not related to the family's goals, they are likely not to be accepted. Okay? So, those are the reasons why the family may not be able to to take appropriate action kahit naman or they refuse to face kahit alam naman nilang problema yon and it has to be resolved. Now, another big barrier to collaborative goal setting between the nurse and the family is the failure to develop a working relationship. Okay? Nothing will be accomplished, as a matter of fact, in a nurse kapag hindi maayos yung working relationship ng nurse at ng family. Kaya importante that you were able to establish rapport with the family that you are serving, no, during the data gathering pa lang, dapat ma-establish natin yung mutual trust and respect. Kumbaga, they have to see us as their partners. Okay? And I know if you're a student, sometimes it can be challenging to achieve that. Pero, I'm telling you, it's possible. It's doable. Kasi makikita ng pamilya yung sincerity ninyo of wanting to help them, of wanting to be their partners. So, dapat, klarado rin sa puso ninyo yung intention why you are there. That you are there as their partner. That you are there to work with the family. Okay? So, yon. So, a good working relationship is very important. So, we can achieve our goals. Okay? The families, the family, unless they see, the nurse as a friend who is genuinely concerned, with their welfare, hindi sila makikipag-cooperate unless makita nila yung genuine concern na yun. That sincerity. That sincere concern. And they will feel that. And you will have to make it happen. You will have to find a way na maramdaman nila your sincerity to serve and to work with them. Okay? But then again, take note, observe the boundaries. Kasi again, nandun tayo to help them, not to resolve all their problems. Nandun tayo to help them become more independent, capable of upgrading, improving their level of health, as a family. Paano? By enhancing their capability to perform their health tasks as a family. Kasi yun nga, if they're able to do those health tasks, then chances are, may iwasan nila yung mga health problems. May iwasan nila yung mga, or mag-i-improve. Mag-i-improve, mariresolve yung mga health problems. Okay? So, another is, take note that the goals set by the nurse and the family should be realistic. Realistic or attainable. So, di ba yung SMART natin? Specific, measurable, attainable, realistic, time-bounded. Importante yun. Otherwise, mahihirapan kayo. Now, punta naman tayo sa objectives. Kanina, broad. Di ba? Yung goal to address, to help, basically, it will address the nursing problem. Di ba? Yung ating mga, yung magawa nila yung kanilang mga health tasks with respect to a particular problem area. So, ang objectives naman, well, same pa rin. It is, again, stated like a client outcome. Also, it should also be SMART, specific, measurable, attainable, realistic, time-bounded. Pero the specific objectives refer more to specific statements of the desired results or the outcome of care you want to achieve that will all lead to the resolution or the achievement of the goal. So usually the specific objectives specify the criteria by which the degree of effectiveness of care are to be measured. Okay, so one example of this, no, so one of the example of this is after nursing intervention, the malnourished preschool members of the family will increase their weight by at least 1 pound per month. Okay, so specific, no? Specific. Merong measurement. 1 pound per month ang specific objective para sa mga malnourished members of the family. Or another example could be after nursing intervention, the family will be able to A, feed the mentally retarded child according to prescribed quantity and quality of food, teach the mentally retarded child simple skills related to the activities of daily living, C, apply measures taught to prevent infection in the mentally retarded member. So, specific ang behaviors that are expected to be done by the client, no, by the family. Okay, so no, usually these behaviors could either be physical, psychosocial states, or behavior of the family as a whole, no, or competencies. So when we talk about competencies, usually these are knowledge, skills, attitude, positive attitude. Okay, for yung ating mga cognitive domain, psychomotor, tsaka affective. Diba? So yun. Kaya importante that we are able to choose the right learning objective, the right verb, the right action word, no? That we expect the client to perform or do or achieve. Okay? So the more specific the objectives, the easier it is, no, to evaluate. And also, the easier it is to attain. Diba? Because these specific objectives define the criteria for evaluation. And also, objectives vary according to the time span, no, required for their realization. So the objectives could be a short-term or a long-term objectives, no? So it doesn't always follow that the goal is a long-term objective. Diba? A goal is a broad statement, no? Pero meron din tayong long-term objective, meron din tayong short-term objective. And short-term objective or immediate objectives are usually formulated for problem situation that require immediate attention, of course. And that the results should be observed in a relatively short period of time. While long-term objective or ultimate objectives will require several nurse-family interactions, no, or encounters, and also more investment on resources. So, yeah. So that is the long term. Meron din namang mga short, medium term or intermediate objectives. No, and an example of this is is in managing malaria. No, an example was given by Dr. Araceli Maglaya. No, yung sabi niya yung goal is the family will manage malaria as a disease and threat. Okay, so that's a broad statement. No, we'll manage malaria. Walang specific statements about how to manage malaria. Basta ang broad statement ng goal ay the family will be able to manage malaria as a disease and threat. And then the short-term objective or the immediate objective could be the sick members will take the drugs accurately as to dose, frequency, duration, and drug combination. All members will use self-protection measures at night till early morning when biting time of malaria vector is expected. Diba? Sa gabi. So that's an example of a specific or immediate objectives. I mean short-term or immediate objectives. Now, how about the medium or the intermediate objectives? All members will have medical checkup and laboratory confirmation, no, to diagnose malaria. So, medium term, intermediate objective. Hindi agad magagawa. Maybe bukas pag pumunta ng center. Maybe bukas pag pumunta ng laboratory. No? Maybe bukas kapag nagpa-check up. Kasi ngayon, na ini-interview mo, pwedeng hindi kasama sa plano nila today to go for medical checkup. Okay, so yan. That's an example of an intermediate or medium-term objective. And then the long-term objective, no, as an example, all members will carry out mosquito vector control measures. Carry out mosquito vector control measures. Oh, bakit long-term? Kasi it will mean repeated repeated performance, no, of these tasks para hindi magka-malaria. Kasi gabi-gabi naman may lamok. Doon yung expected time of biting, no? Lalo na yung mga malaria vectors. So, yeah. Kaya long-term objective na dapat ma-develop ng family so that they can develop healthy habits, healthy practices to avoid developing certain diseases like ito nga, yung malaria. Okay, so yeah, so that is how we formulate goals and objectives. Okay, so sana malinaw, no? At and also, of course, kailangan when you develop objectives, you will always check, does it resolve all these specific objectives? Does it really resolve the nursing problem? No? All these specific objectives put together, will it lead to the resolution of the problems? Will it lead to the family's enhanced capability to perform their family health tasks? Yung 5. No? Will these objectives will help the family recognize the presence of the problem? Will these objectives will help the family make appropriate actions or make decisions with respect to taking appropriate health actions? Will these objectives help the family provide a home and environment conducive to health? Will these objectives enable the family to provide adequate care to the sick member of the family? Will these objectives enable the family to utilize community resources? Kasi kapag na-achieve yun, then mariresolve yung nursing problem, yung health problem. Diba? So yun. Okay. So on that note, I will end this session and I will prepare another recording for developing the intervention plan naman as well as implementation. Para sigurado, ako mismo, I will be at peace. Na yung grupo ko kahit ilang linggo kaming hindi nagkita, nagkausap, walang face-to-face interaction, nagkaroon ng bagyo, ilang linggo na walang sync discussion, through this recording man lang, I will be at peace that I have guided you enough. Okay? So again, refer to the lectures prepared by Ma'am Filoteo and Ma'am Sugay, para sa mga handouts, sa PowerPoint. Pero ito, wala kayong nakikitang PowerPoint or handouts. Kasi I just want you to feel my presence. Kasi wala nga tayong face-to-face encounter. Diba? So kahit puro mukha ko yung nakikita ninyo, I really don't mind. What's important is, maalala ninyo yung dynamics ng ating discussion. And through this man lang, maalala ninyo yung mga concepts. Okay? Thank you everyone for joining me. And see you to sa next session natin. Bye!